community study is looking at many of the counties across the state that have been highly impacted by overdose, and it is looking to increase information and education in the communities where the study is based, and it's looking to decrease overdoses by 40%. It also is looking to decrease stigma, which we know is an important barrier for individuals seeking treatment for substance use disorder and staying in treatment for substance use disorder. It's also increasing awareness on the use of medications for opioid use disorder, which we know specifically for methadone and buprenorphine decrease the overdose-related mortality and all-cause mortality by at least 50%, which we can't say for many medications that we use in healthcare. So I think there are a wide variety of barriers, stigma as being the number one barrier. So there unfortunately, many individuals who are using substances and or have a substance use disorder face stigma in healthcare in general, but also in settings where we might not anticipate it, going to the pharmacy to pick up their prescription, going to a mutual support meeting. There's often a lot of sentiment that is against medications for opioid use disorder being interpreted as, and I'm going to put this in quotes, substituting one addiction for another, because people don't understand that these are life-saving medications. There may be other barriers, transportation barriers, childcare barriers, family barriers. So again, stigma towards medication. So people may be getting pressure from family or other loved ones not to be on medication. Folks don't understand that just like addiction is a chronic medical condition like diabetes or high blood pressure, where people may need a medication for their lifetime, it's exactly the same with substance use disorder. So a person shouldn't have to go specifically to an addiction medicine specialist or to a treatment center for substance use disorder specifically to access buprenorphine. The waiver was removed federally last year, and so now any medical provider, so that includes a PA and physician assistant, a nurse practitioner, or a physician, or any other advanced practice nurse, can write a prescription for buprenorphine without any kind of waiver being necessary. There are no patient limits anymore. So we really want to integrate care into any medical setting. So whether somebody is an obstetrician gynecologist or an adolescent medicine physician or a family practice physician, folks should be able to access medication at any door that they walk into for medical care. That would do a lot to eliminating stigma and eliminating barriers. So I think it's important to realize when anybody starts using substances, for whatever reason they do start using substances, and for many people, using substances is a coping mechanism for things that they have experienced in their past and or symptoms they may be experiencing currently. And so I think if we know people's stories and listen to people's stories, then we will have a lot more empathy and understanding for individuals who use substances, and recognize that substance use could happen to any of us at any time.